very rare that that's the two of them. Shandro goes first.
Yes.
Good afternoon. I'd like to provide Albertans with an important update that impacts everyone who has a loved one in a continuing care facility in Alberta. We'll continue to get vaccines into the arms of Albertans as soon as we get them. And that brings me to today. I'm here to announce that we'll soon be safely easing the restrictions in place in long-term care and all other continuing care facilities in the province. Since the start of this pandemic, elderly folks have faced one of the toughest burdens. This virus is merciless, and they have been at the seniors in continuing care and other facilities have been at the highest risk for serious outcomes from the virus, including more severe illness, hospitalization, and death. Sadly, the risk has been even greater for those living in congregate settings like long-term care facilities and nursing homes. Our numbers in Alberta show that these facilities have been uniquely vulnerable to this virus. I want to recognize the resilience of the residents and their families, as well as the dedicated staff and operators. This has been an incredibly tough time for all of them. These folks have navigated the past year with great uncertainty, stress, and loss. Sadly, more than 61% of the COVID deaths that we've had in the province were residents of continuing care. That's more than 1,200 grandfathers, grandmothers, parents, brothers, and sisters who lost their lives to this virus. That's why we first implemented strict restrictions last spring to help limit the spread of the virus and keep residents safe. It's also why Alberta's continued updating those measures throughout the pandemic. There is no question that the restrictions we put in place were necessary and helped to save lives. But we also know that this protection has come at a real cost. Unfortunately, the same restrictions, no matter how necessary, have negatively impacted other aspects of residents' health. These folks need joy, hope, and connection just like everyone else. And from day one, we've committed to doing everything possible to protect continuing care facilities, but also not leaving measures in place any longer than necessary. Protecting continuing care residents from COVID cannot mean locking them up without compassionate visits or without social visits that they have so they have contact with loving family and friends. We must also balance the need to protect people from COVID-19 with the need to support the overall health and well-being of the people we are striving to protect, including their mental, emotional, and spiritual health. Recently, we've heard from many residents and families asking for change. They've said that the rules are causing great distress and in some cases, significant declines in the health of residents who have grown depressed, isolated, and lonely. Nearly all continuing care residents and the staff, majority of staff are now vaccinated with a double dose administered more than 2 weeks ago, which dramatically reduces their chance of infection and serious illness from COVID-19. So today, it's safe for us to take a step forward. As of May 10th, we'll implement a new public health order to safely ease continuing care restrictions across the province. This new public health order will increase the number of designated support persons who can be part of their loved one's care team in a continuing care facility from 2 to 4 people. And it will allow facilities to have small indoor and larger outdoor visitations if residents feel it's safe to do so. Minister Shandro will provide more details in just a moment. But I want to emphasize that this is a safe and prudent step forward. We're not getting rid of all of the restrictions at continuing care facilities. There will continue to be limits on who can visit and how many, and strong outbreak protocols will remain in place. There are no risk-free options, but we've heard loud and clear from residents and families that they want this change. And vaccines are giving us the opportunity to do so. As soon as vaccines first arrived, we made it a priority to vaccinate continuing care residents and staff as quickly as possible. The results are as clear as day. As this graph shows, we've gone from a high of 831 active cases in long-term care on the 27th of December to 44 active cases as of this past week, a 95% decline. The same steep decline is seen in designated supportive living facilities. On Christmas Day, we reached a peak of more than 1,300 active cases in those settings, but since then, cases have declined by 92%. And this final graph shows the decline in COVID-19 fatalities that have occurred over the past few weeks. As you can see, we have experienced a downward trend in the number of deaths reported from averaging a high of 167 a week at the end of December to 25 over the last 7 days. These results show us the power of vaccines, and that is why, despite seeing sharp rises in cases in other age groups, this third wave has not impacted those age 70 and older in the same way. And that's why we're able to ease the restrictions on continuing care residents and their families. We have now immunized more than 83% of Albertans aged 75 and older, and close to 100% of residents living in long-term care settings. More than 75% of Albertans between the ages of 65 and 74 have the vaccine, and more than 55% of Albertans between the ages of 60 and 64. More than 37% of Albertans between the ages of 50 and 59 have received at least 1 dose. And almost a quarter of those in their 40s now have the vaccine since we opened up the AstraZeneca to that age group last week. Yes, Gen X has stepped up, and in a big way. Over the last week, we've administered more than 87,000 doses of AstraZeneca in 1 week. All of those doses of AstraZeneca have gone from sitting in fridges into the arms of Albertans, including my own. In a matter of weeks, all of these people will be much more protected against COVID-19. What's more, we have another 56,000 appointments booked for the next 7 days. We continue to have the widest eligibility criteria in Canada for the vaccinations, and Minister Shandro will be announcing another expansion today. More than 2.3 million people are able to book their vaccine. That's roughly half of the province. Thank you for everyone who's stepping up and getting their shot. If you haven't and are eligible, please book your vaccine appointment today. And if you're eagerly waiting to book, I'm here to tell you that your time is coming soon. Which is why I'm also pleased to say that more than 15,000 essential workers at 136 federal and provincially regulated meatpacking plants across the province will be getting their vaccines starting this week. Meatpacking plants were identified as an eligible group under Phase 2C of the rollout, but limited supply delayed this step until now, particularly recent cancellations of Moderna doses. Minister Shandro will have more to say on this in a second, but I just want to say that I'm glad Alberta is able to offer vaccines to these hardworking people who contribute so much to our entire country's essential food supply system. We will not stop until every Albertan who wants the vaccines get them. The sooner we're all immunized, the sooner we can get past the pandemic. Every day, more of our most vulnerable friends and neighbors are protected, and every day we get closer to life returning to normal. Thank you, and I'll now invite Mr. Shandro to make these additional announcements and then look forward to your questions.
Thank you, Premier, and good afternoon, everyone. As Premier said, I will provide more details on the easing of the continuing care restrictions, and then after that, I have also two other announcements and then one final comment. So first on continuing care, we first brought in strict restrictions in continuing care facilities last spring to help limit the spread of the virus and to keep the residents safe. And we've continued to update them throughout the pandemic. With the change that we are announcing today, each resident will be able to have up to 4 people as designated family or support persons, and previously it was 2. Also, where possible, and provided that the majority of residents agree, indoor social visits with up to 4 visitors will be able to resume again, as long as they're all from the same household and they follow distancing, masking, and other health measures. And finally, outdoor social visits in these facilities will expand to 10 people, including the resident. Now, this is double the current limit of 5, and it brings this in line with the rest of the province when it comes to our current outdoor limit for social gatherings. Now, it's important to point out that visitors will continue to be able to visit when a resident is approaching the end of their life or suffer a change in their health status. And as I mentioned, these changes are not mandatory. They need the agreement of residents because these are more than care facilities. They're people's homes. And so this will vary site by site. And each site must work with their residents to develop their own visiting approach within the guidelines that are set out in the order. And this will take time, so these changes will not take effect until, as Premier said, May 10th. And this is a cautious but safe way to make life a little bit better for mothers and fathers, for parents and grandparents. And as Premier said, this is all possible thanks to the vaccines in our vaccination program. It also reflects the dedication of the operators and their staff of these continuing care facilities. To take just one example, they've all achieved compliance with the order that staff work at a single site, 100% of these care facilities. And that was a huge challenge for all of them, but they've done it. And on top of that, or on top of the easing of the restrictions for continuing care facilities, I'm also happy, as I said, to make 2 other announcements. So first, starting tomorrow, we'll begin offering vaccinations for workers in meat packing plants. And vaccinations will be offered to all 15,000 workers at all federally and provincially certified plants across the province. Now, there are 136 of these sites across the province, and in order to vaccinate as many workers as possible, as quickly as possible, a variety of approaches will be used, including on-site clinics, pharmacies, and AHS clinics. And these workers were, as you know, already identified as being eligible under Phase 2C, but delays in the vaccine supply prevented us from starting the program until now. All of these workers will be offered at least 1 dose of a COVID-19 vaccine within the next few weeks, provided that vaccines arrive as scheduled. And on top of that, a pilot project led by a team of researchers from the University of Calgary will begin at the Cargill plant at High River. Now, the goal of this project will be to combat vaccine hesitancy by providing translated materials and on-site translators at the meatpacking plants. Now, I said there were 2 announcements. The second announcement and last one, although I will have a final comment after this, but the second announcement I'm pleased to make today is that starting tomorrow, Albertans born between and including 2006 and 2009 with an underlying health condition can get immunized with the Pfizer vaccine. Now, these are young folks who are turning 12, 13, 14, and 15 this year with the conditions that we previously opened up to those who are 16 and older in Phase 2B. And this includes conditions such as chronic heart, lung, liver, or kidney disease, severe learning or developmental delays, and those who have been diagnosed with cancer in the last year. And it's important to note that we're acting on the evidence. The National Advisory Committee on Immunization has recommended that the Pfizer vaccine be used to immunize 12 to 15-year-olds who are at high risk of severe outcomes if they contract COVID-19. And this is in line with what other jurisdictions are doing, including Ontario. Now, parents or guardians who are making the bookings for youths who qualify are asked to speak with their physician to discuss the decision. After that has happened, they can get a doctor's note and then book an appointment at a pharmacy, or they can call HealthLink at 811, or they can make an appointment at an AHS clinic. Now, we've been working to protect the most vulnerable Albertans, and I'm pleased to see that this progress from our oldest citizens to the youngest group. And I know that many families have been living very carefully over the last year, avoiding even the slightest chance of infection, and likely even going out without seeing other loved ones in order to protect their tweens and their teens. And finally, I want to highlight the announcement made this morning that we're making it easier and less expensive for organizations to deliver rapid testing programs. Businesses and service providers who want to use free rapid tests will no longer be required to have a healthcare provider oversee their screening program. And this change will allow an organization to participate in the rapid testing program without the need to find and pay for a healthcare provider. And these announcements today are crucial steps forward in our immunization plan. I hope that these will ease the worries that we all have for our loved ones and get us closer to a post-pandemic life. Thank you.
All right, we'll now be taking some media questions. Just a reminder to folks on the line to please either limit yourself to 2 questions off the top or 1 question and 1 follow-up. And with that, operator, can you please put through our first caller?
Bill Fortier, CTV News.
Hi, just a question about the current active cases, over 20,000, currently the highest per capita in Canada, and our rate is still above 1. So this is for the Premier or the Health Minister, but you know, with current restrictions in place, including retail and dining rooms shut down, I'm wondering, where's the spread happening? Where are we seeing the spread?
Thanks. First of all, we did predict that we would probably hit 20,000 active cases this week, about 3 weeks back, when we announced those additional measures. And so a lot of what we're seeing now was, in a sense, baked in prior to these measures. We have seen a decline in the rate of growth, which is good news, but we have to bend that curve down further, as you say, to get the R below 1, so we start to see the number of daily new cases and total active cases begin to come down to relieve the pending pressure from our healthcare system. You know, your question's a very good one, because our restrictions are broadly similar to those in British Columbia, where they do see, I understand they're seeing a decline in cases. The only significant difference is they've just imposed some regional travel restrictions, which only came into effect, I think, today. So, you know, in other jurisdictions, we see similar policies bending down the curve. A lot of this has to do with weather, I sure hope, and seasonality, so I sure hope we can start to get some decent weather here. And of course, the vaccines are gradually starting to catch up. As of now, as of tonight, about a third of Albertans over the age of 16 will have received at least 1 dose. Another 10% or so have antibodies from prior natural infection. So we're starting to get to a pretty good critical mass of the population that can break the chain of transmission and not become sick through that protection. But let me give you a couple of examples of where we've seen elevated case numbers recently. As you know, we have very high cases right now up in the Wood Buffalo region. And a lot of that appears to have occurred at work camps where people were socializing after hours and not wearing masks, not taking those basic precautions. Similarly, we've seen a significant spread in the Banff area in the Bow Valley corridor, and again, a lot of that appears to have come out of dorms, staff dorms and congregate living facilities, probably with socializing attached to that. So, and look, I don't say this to blame anybody. I think it's totally understandable that people who work long hours and don't have opportunities to socialize with family in those camps will, or in those staff quarters, will sometimes get together and perhaps just kind of forget momentarily about the rules in place. But that's the kind of transmission that we've seen. Again, by far the largest source of transmission in Alberta continues to be at home and socializing. Very much less so businesses. So, when people call for additional restrictions, I mean, we're not seeing huge outbreaks because of hairstylists who can receive customers, both of them wearing masks by appointment. We're not, so a large portion of this is coming out of, again, transmission at home and social contact, social activities.
Thanks, Bill. Did you have a follow-up at all?
I do, and it's actually about Wood Buffalo. Of course, the municipality has now declared a state of local emergency, and they're calling for a few things, but two specifically. They're asking to meet with federal and provincial politicians immediately, and they're asking the province to fast-track the vaccine for residents in Wood Buffalo. Will you do either of those things, and are you committing? Are you considering?
First of all, we certainly share the concern of the municipal government in Wood Buffalo about the high numbers that they are experiencing, which is imposing real pressure on the Fort McMurray Hospital. And I've been communicating with Mayor Don Scott. I believe Minister Shandro has, his deputy minister has. So we are reaching out and communicating not only to the RM of Wood Buffalo, but also to some of the local First Nations who are understandably concerned. And we are happy to work with them on additional measures, including providing greater vaccine supply. My understanding is that Mayor Scott specifically has asked for us to lower the minimum age threshold for vaccines in that region. But of course, we follow the scientific advice that we get from both the national and Alberta advisory committees on immunization. And that's why we have the threshold of 40 on AstraZeneca, for example. I would point out that Fort McMurray and the broader Wood Buffalo are significantly below the province-wide average for immunization to date. And so I think there appears to be in part perhaps a bit of a demand problem, but also we need to make sure, because a lot of shift workers up there, that they're able to get to the vaccines when they're not working. So we're going to be working with the local health authorities as well as the municipal government to see how we can get vaccines more conveniently delivered to people and work with the First Nations on the same issue. I know there had been some reports of vaccine hesitancy amongst some of the First Nations up there when we first made those vaccines available. And I'll remind you that they are available at a much lower age category than the general population, given the more difficult health outcomes from COVID-19 experienced by Indigenous people. Tyler, would you like to add anything to that?
Yeah, just a couple of things. First, Dr. Hinshaw and I have a meeting booked with the regional municipality for tomorrow for further discussions. We'll reiterate for those folks tomorrow, and I'll say it again here, as Premier has said many times, that Alberta's government will do whatever it takes to ensure that residents have the support that they need, including for McMurray in the regional municipality. I also say that more than 500,000 of rapid tests have already been provided to the oil and gas sector, including more than 50,000 to the work camps that are in the region. We're happy to also look at other ways in which we can support the municipality and others in the area. But we are taking this seriously, and we'll have more to say tomorrow after we meet with the regional municipality.
All right, thank you, Minister. Operator, can you please put through our next caller?
Julia Wong, Global News.
Hi, this question is for the Premier and the Health Minister. The Emergency Management Cabinet Committee was supposed to have met today to discuss the numbers as well as potentially introducing more measures. So what was discussed and were measures brought up?
Well, first of all, Cabinet, of course, Cabinet deliberations are confidential, but we had an update on the current state of the pandemic, as we do on at least a weekly basis. And we discussed the measures that we've just announced that have been approved, and some other initiatives that are underway. So in terms of the overall situation, we predicted about 3 weeks back that we would be reaching about 20,000 active cases in this last week of April. And as I said last week, we continue to be very concerned about the high numbers. And that's why we urge Albertans to buckle down in these next few weeks until the vaccines can catch up with the variants. We do see numbers stabilizing in other provinces and coming down in other provinces like BC that have broadly similar restrictions and COVID policies to the ones we've got here in Alberta. And we do see a reduction in the rate of growth for new cases in the province. We just need to take that next step and get those numbers down so they start shrinking. The good news is that vaccines are moving forward pretty quickly here, with nearly a third of the adult population vaccinated, plus 10% with pre-existing natural immunity. We've always known that this period was going to be a particularly difficult one because of the variants, but we'll continue closely to monitor that. As I've always said, we'll take additional measures if we deem them to be necessary to protect the healthcare system. Right now, we just call, as I said before, when we're looking at some of the largest outbreaks in the province, they've happened where people just weren't following the basic rules that we've had in place for months. So more rules do not necessarily increase compliance. In fact, they could actually, I think, increase COVID fatigue. We will continue to closely monitor this and take the actions that we deem necessary.
And did you have a follow-up at all, Julia?
Yes, I do. Thank you. Premier, the numbers that we're seeing right now are comparable to numbers that we've seen in the second wave. They're mirroring the second wave, and doctors are calling for more to be done now, so they don't need to be worried about more stresses put on the healthcare system. So we've been in this situation before. How come we're dragging our feet when it comes to introducing new measures?
No one's dragging their feet, and I'd point out again that there's a lot more at play here than simply restrictions. I know that those who are advocates of hard lockdowns would like to have basically shut down our society indiscriminately for much of the past year. I think that would have been an unbalanced approach. Our approach has always been about risk management to prevent an overwhelming of our healthcare system while also minimizing the damage to our broader social health through restrictions. And I think Alberta's done a pretty good job of that. One thing is dramatically different between the context now and the one that we faced in before Christmas, and that is the effect of the vaccines. As I mentioned, we've seen a huge decline in infection and hospitalizations as well as fatalities with those Albertans who are most vulnerable to this disease, namely the elderly and people with pre-existing conditions, because they've been vaccinated, in many cases double dose vaccinated. And so we have seen the percentage of cases that end up being hospitalized come down, and of course the fatality rate come down quite dramatically as well. So those are different factors, and that protective effect of the vaccines plus natural immunity will continue to grow. That doesn't mean we should be unconcerned about the current high daily case numbers. It does mean that Albertans have got to follow the basic rules, because more rules don't mean more compliance.
All right, thanks, Premier. Operator, can you please put through the next caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I just want to go back to the Wood Buffalo question. Both the Premier and the Health Minister have said that, you know, you're looking at what you might be able to do for Fort McMurray, you'll be there for them, that type of thing. I'm wondering if you can be a bit more specific. Is it realistic that you may ship extra doses of vaccine to that region?
That's one possibility. We've already provided a lot of extra support for that region. For example, as Minister Shandro mentioned, we provided tens of thousands of rapid test kits to some of the oil sands work camps to help them in detection. And the population up there is disproportionately Indigenous. As you know, we've had a much lower age eligibility for vaccination for that First Nations population. And we've done a lot of extra outreach efforts working with the First Nations to address vaccine hesitancy and make it as convenient as possible in a culturally sensitive way to deliver those vaccines. And we are in ongoing discussions with the municipal government, and we are prepared to provide additional supply to the extent that we can. Obviously, our overall supply is constrained, which is a problem everywhere, but we are prepared to do that. But I would point out that there's every day been a significant amount of unused supply that's already been made available to folks in that region. I'm not being critical of anybody. I'm simply saying that the problem does not appear to be a supply problem. The problem appears to be when it comes to vaccines up there, it's matching up the people who are eligible with the doses that are already in the region. And so we've asked AHS to look at and work with the municipality on how we can solve that problem. Again, some of it may be because of the work shifts, and by the way, we're offering to work with the major oil sands companies to partner in administering vaccines where it makes sense, for example, in work camps and on work sites. One other thing I'd point out is that right now is the big turnaround season for equipment maintenance in the oil sands, and that means it's a period when there's a lot of workers from across the country who come in. It's kind of a workforce surge that happens in the spring, especially this year. A lot of the companies have decided to increase their turnaround efforts, and so a lot of the people who are coming in may already have been partially vaccinated, have received a single dose in their provinces of origin. So there is a certain complexity with the mobility of that workforce. Tyler, would you like to add anything?
Well, just perhaps also to point out that right now we have 430,000 appointments that have been booked through our pharmacies and AHS. So if and knowing that we get, as soon as we receive vaccines, we turn around and provide it to AHS and the pharmacies and our family docs as quickly as possible. So right now, if I mean, we're happy to have conversations, obviously, with the regional municipality tomorrow to understand what the request is more specifically. But I think we also have to point out that we don't want to be taking away vaccines that have already been booked by those who've made those 430,000 appointments.
And I'll just add that based on the latest data, 17.2% of residents of the RM of Wood Buffalo, excluding Fort McMurray, have been vaccinated with at least one dose, and 13.9% in the city of Fort McMurray have received at least one dose, and that compares to 25.2% province-wide. Now, that again is not a supply issue. The supply is there. It's just that maybe the clinics and pharmacies have not been convenient enough for folks. Maybe there continues to be an issue of vaccine hesitancy in some of the surrounding First Nations. Those are issues that we have to work through, and we're happy to do so with the municipality and with First Nations leadership.
Did you have a follow-up at all with that, Carrie?
Yes, building on that, you had mentioned a few times that you may have identified vaccine hesitancy in some of those Indigenous communities. Now that you've identified it, what are you doing specifically to address it?
Well, I would point you to a CBC story, I think back in January, about a clinic that had been set up to administer vaccines, I think in the at Fort Chip, and a lot of the vaccines were going unused, and they had about half as much traffic as they had expected. After that, I personally reached out to some of the Treaty 8 leaders, and Minister Wilson, our Minister for Indigenous Relations, has been in constant contact with them, as has the First Nations and Inuit and Métis Health Branch at the Department of Health, to offer any help that we can to communicate in culturally appropriate ways to the community. And I want to commend the chiefs and their administrations for making a real effort. I think we have seen the take-up of vaccines in those communities increase since the program started in January. But we'll keep working with the chiefs, taking on board their advice about how we can perhaps correct any misunderstandings that exist and to make the process as convenient as possible. We've done that not only in First Nations reserves, but also in the cities with the Native Friendship Centres. We've worked with the Métis Nation of Alberta to have them administer vaccines in Métis vaccination centres. We've done, I think, everything that we can to reach out specifically to those communities.
Okay, we have time for about 3 more callers today. Operator, can you please put through our next caller?
Graham Thompson, iPolitics.
Thank you. Premier, you've been very clear on your support for vaccines being a very important part of this fight against COVID. But you have members of your own caucus, I'm thinking of Angela Pitt, last week put out a tweet saying to people, look, you can get a vaccine or not, it's up to you, do your own research. What do you say to her and to Albertans who are listening to her about this?
Well, that there is no legal requirement that people take a vaccine, but we strongly encourage them to do so. It's the right thing to do for your individual health and for your loved ones. It's the right thing to do for our broader community. But Graham, we actually have an amendment to the Public Health Act before the legislature that removes the power of government to legally force people to be vaccinated, a power that has been in that law since, we believe, 1910. It's never been used, and it was Dr. Hinshaw's advice when she was being she appeared before a special legislature committee in September of last year that we wouldn't use it, and she had no objection to it being removed from the statute. So I do think that, Graham, in most of the polling, we see about 10% of Albertans who are pretty have their minds made up that they won't take the COVID-19 vaccine, and another, depending on the poll, roughly 10% who say that they are unlikely to, but it sounds like they're persuadable. And I kind of think for that group, that key target group, that if it's their own idea and they don't feel like they're being hectored into it or forced or bullied into it, I think they're more likely to come to make the right decision. We will be launching a much bigger, we've been advertising on the benefits of vaccination already, but we'll be launching a much broader vaccination promotion advertising program, especially targeting those folks as soon as we get enough supply to move to phase 3 and address the general population. So yeah, I do think it's important that we underscore that this is not mandatory. The government's not going to force a needle into your arm, but it's the right thing to do. And these vaccines are safe. They are, and of course, any medical intervention, including a vaccine, carries some level of risk, but the risk here is infinitesimal compared to the risk posed by COVID. So that's what I would say to folks who are skeptical.
And do you have a follow-up with there, Graham?
Yes, I do. Just to follow up that, Angela Pitt was one of your MLAs who signed that letter a few weeks ago criticizing the government for bringing in, or at least going back to step 1 restrictions. Now, Nathan Cooper, I know you were upset by that. I can see why. He's Speaker of the Assembly, and he then apologized for getting involved in that. But Angela Pitt is Deputy Speaker, and as far as I know, has not apologized for signing that letter. Would you want her, as an MLA, as Deputy Speaker, to apologize to the House for getting involved in this controversy?
Well, I've asked the Speaker to take that up with his Deputy Speaker. You know very well, Graham, that in our system, the office of the Speaker has a unique kind of independence and neutrality, a unique status, and Deputy Speaker, there's always been somewhat greater latitude for Deputy Speakers to engage in debates, to vote, etc. So I quite frankly think that is in a bit of a gray area. I was clear that I believe what the Speaker did in this respect was totally inappropriate, and I do apologize, his recognition of that and his unequivocal apology, and I've suggested that when it comes to the neutrality of his deputies on matters of great public contention, that he should take that up and define what the parameters are.
Great. Thank you. Operator, can you please put through our next caller?
Vincent McDermott, Fort McMurray today.
Hi, Premier. Just regarding the commuter camp issue, many out-of-town workers in commuter camps never see Fort McMurray.
Right.
A lot of them are flown in or they're bused directly to the camps for their shifts, and then they just leave. Alberta Health has also told local media that local cases in the daily updates don't include out-of-town residents. So to clarify, are you saying a lot of this local spread comes from contacts between commuters and local residents at the site?
No, Vince, that's not what I said, and nor is it what I intended to say. I think you're absolutely right in characterizing the flow of workers to a lot of those camps. I believe, and I'll double check and stand to be corrected, Tyler, if I'm mistaken on this, but I believe that the numbers that we report for the local geographic area include everybody, whether they are permanent residents of Fort McMurray, whether they are itinerant workers in the RM, or whether they are Indigenous members of First Nations reserves, for example. So those figures don't make a distinction, and I acknowledge that there's not a lot of transmission between the city and some of those work camps. What I was characterizing is I was briefed by our public health folks that there had been some outbreaks in some camps where it appears that there was after-hours socializing without masks and without following the basic public health guidelines. And so we're reaching out to work with the employers and the work camp operators to make sure that they do everything they can to see that those rules are respected. Tyler, did you want to add anything or precision on that?
No, I think you got it exactly right. That we do have these boundaries that AHS has typically used from before the pandemic for us to be able to report numbers publicly and to Emergency Management Cabinet Committee. And it does include not just Fort McMurray proper, but also some surrounding areas, as often happens through these local geographic areas that we use. For example, the nations surrounding Maskwacis are included in the Ponoka County LGA would be an example of another situation like that.
Okay. Do you have a follow-up there at all, Vince?
Premier, I have to correct you because this morning, Suncor confirmed that a Garda contractor at Suncor's base plant died, and this death is not reflected in local case numbers. I'm also getting messages right now from people who work at the city saying that, well, you're wrong in that it doesn't include commuters, in that these numbers include commuters.
Well, Vince, it's not the first time that we've had cases in the region, and particularly in work camps, and I've always been informed that all of the cases in the local geographic area are incorporated. We don't have separate geographic breakouts based on the precise locale or the workplace. And in terms of a death that may have gone unreported in today's statistics, sometimes there is a delay of a day or two before all of the mortality statistics are included in the province-wide report. But these are pretty technical questions, and I will ask that Dr. Hinshaw's office get back to you with any precision that you need on the compilation of the statistics on that in the local area. Tyler, is that fair to say?
Yeah, absolutely. We'll follow up with you, Vince.
Okay, and operator, with that, can you please put through our last caller of the day?
Francois Joly, CBC.
Hi, yes, this is a question en français for Premier Kenney. Monsieur Kenney, on voit énormément de cas dans la région de Wood Buffalo, Fort McMurray. Il y a des demandes de la municipalité là-bas pour envoyer davantage de doses de vaccins. Ça avait été évoqué aussi, je crois, pour la région de Banff, donc c'est les deux régions les plus touchées en ce moment. Est-ce que vous envisagez ça comme solution d'envoyer, de prioriser certaines régions en Alberta qui sont très touchées par la COVID pour essayer de faire baisser la température? Là?
Oui, évidemment, nous nous inquiétons de la situation dans la municipalité de Wood Buffalo, la ville de Fort McMurray. J'ai communiqué avec le maire à cet égard et le sous-ministre de Santé a fait la même chose. Le ministre et Dr. Hinshaw va rencontrer les dirigeants de la communauté demain. Et on a indiqué qu'on est prêt d'appuyer la région avec l'appui supplémentaire, y compris si c'est nécessaire, les doses de vaccins supplémentaires. Mais cela étant dit, nous voyons qu'il y a beaucoup de doses dans la région qui n'ont pas été utilisées jusqu'à maintenant. Alors, il y a une question de demande ou peut-être de l'accès aux ces doses de vaccins. En tout cas, on va travailler de près avec les autorités de santé publique locale et du gouvernement municipal et les leaders des nations autochtones dans les régions pour faire tout ce que possible pour protéger les gens. Point.
Do you have a follow-up at all?
Yes. Oui, Monsieur Kenney, toujours. On voit le nombre de cas qui continue d'augmenter, les hospitalisations qui continuent d'augmenter, qui se rapprochent de ce qu'on avait vu lors de la deuxième vague. Est-ce que je comprends de votre part que la stratégie en ce moment, c'est d'attendre et de voir si les vaccins vont faire effet?
Non, effectivement, je vous rappelle que dans les dernières semaines, nous avons pris les mesures supplémentaires, par exemple, une annulation des activités sportives parmi les jeunes dans les systèmes d'école, des systèmes scolastiques à Calgary, Edmonton et Fort McMurray. On a mis en place les dernières mesures, effectivement, jusqu'à plus de 2 semaines. Nous avons attendu 20 000 cas actifs cette semaine, depuis longtemps, à cause de l'activité qui se déroulait il y a quelques semaines. Heureusement, nous voyons une diminution de taux de croissance dans les nouveaux cas, mais il faut aller plus loin. Il faut évidemment voir une diminution. Je vous rappelle que dans certaines autres provinces, comme la Colombie-Britannique, ils ont les balises, les mesures presque identiques que celles de l'Alberta, mais ils voient une diminution des cas. Peut-être le climat joue un rôle à cet égard, mais la différence principale maintenant, entre maintenant et la situation avant le Noël, est les vaccins, parce que nous voyons une diminution importante dans les hospitalisations des vulnérables et des morts, évidemment, des personnes âgées et des vulnérables. Alors, la situation, le contexte est largement différent. Mais si il faut prendre les mesures supplémentaires pour protéger les vies et le système de santé, nous les prendrons.
All right. Thanks very much. That concludes our Q&A today. Thank you for joining us.
Thank you, everyone.